sometimes overlooked, but there is nothing more important than health care and the access to health care and the ability to see a doctor and the confidence that if something is wrong with you, or if you feel like something is wrong with you, that you will have that ability to at least get some care. And a long time ago, there was some disparity in healthcare in the larger cities and in the smaller communities. But thanks to some new technology and thanks to an institution like Navicent Health, significant improvements have been made as it relates to rural healthcare. And I'm so happy to have with me today two young ladies who's going to talk all about not only how the access to healthcare has improved in rural areas, but also about some technology that's going to make it easier and more convenient and make it available to more people. This is a call to action.
A call to action.
Very good. I'm your host, Alex Habersham. And as I said, I'm very, very happy to have two young ladies with me today. And let me tell you, they both are administrators of hospitals that I guess you could call them rural. But we're going to have something like a fireside chat today, although they both got different topics to talk about. But I want to just chime in, Lorraine and Laura, and just kind of talk about it like from, using like the community platform. So if one of us says something and one of you wants to jump in on it, then feel free to do so. But we're going to start off by letting you do a short introduction of yourself. We're going to begin with Laura.
Hey there, my name is Laura Gentry, and I'm the CEO of the Medical Center of Peach County. We service a large rural community. Even though we're close to Houston County, the west of us is very rural. So we service Peach, Macon County, Crawford County, Taylor County. That's a big part of our service area. So we're a 25-bed critical access hospital, and our goal is to be able to keep patients close to home with our care and provide quality care. My background is nursing, and I've moved into this role. I've been in it now 3 years.
Very good. Miss Lorraine?
Hi there. So I'm Lorraine Smith. I'm the CEO at Monroe County Hospital, which is managed by Navicent Health. And we too were a 25-bed critical access hospital located in Forsyth, Georgia. And Navicent Health has been huge, and Atrium Health as well, in helping us keep patients close to home and take care of them where we are. So Alex, if you didn't know, Laura and I actually used to work together at the Medical Center of Peach County. So we've been a team for a very long time. So it's interesting now that we're both CEOs of our own hospitals, and we still work closely together on a day-to-day basis to take care of patients every day.
Okay, let's first of all, and I guess either of you or both of you can chime in, talk about rural healthcare before there was the kind of advancement that we have now, when there was a real need for an improvement in rural healthcare.
So I think when we talk about rural healthcare, the biggest issue that we have is access. So we're normally in remote areas that it's difficult for patients to get to major medical centers. And then also when you think about taking care of patients, one of the things that's so important, think about it, if you're a working mother with 2 children and your mom is hospitalized, sometimes to be able to go right in your backyard, park close to the front door, enter a hospital, and see that grandmother or your mother, grandmother of the children, and bring those children along, that does so much for the patient. And also when you have a patient who might have mobility issues or a hard time getting around, being able to access a small critical access hospital is so much easier for them than normally a major medical center. Now, if their care requires them to be in a major medical center, then absolutely, we get them to where they need to be to receive the care that they need. However, if you can keep them in a facility like ours where they're easily accessible and really have that hometown feel where we're able to provide a blanket, get them an extra cup of water, just our volume allows for that, then it's just so much better from that patient care perspective. Everyone has a place in that continuum of care, for sure.
Absolutely.
And then I would just like to say, as it's important, and one of the main focuses I've had as a CEO of a rural hospital is physician recruitment. It's hard to ensure that you get physicians in rural communities. So what role can we play that we, can make sure that we can recruit and have a strong team of physicians and mid-levels are nurse practitioners and physicians assistants, and can we utilize them in our rural community to make sure that we have quality health care. So that is our, it's about keeping people close to home, and also about making sure they get high quality care, best practices close to home.
Have you seen an increase in volume since, and I know we're going to talk about technology in a minute, but just talk about generally what kind of improvements in the community now, because I know it's comforting, if you please, to know that there is a facility close to you that will and can treat you if you are ill. So, and one thing, Laura and Lorraine, I got to get these L's straight. One thing, you talk about this, but I think that sometimes that lack of immediate quality care and distance can discourage people from seeking help.
Yes.
Which contributes significantly until they're getting worse. So just talk about how the increase in access has increased the volume and the number of people that you send, if in case you do see more people.
Well, Lorraine, if you don't mind, I want to jump on that one, because I think part of it is having access, but also getting the community to have confidence in you. And that was, that is where you can't just say, hey, we can do your x-ray and we're here, and then it not, have customer service attached to it. Just being like I mentioned a while ago, quality of care. So you've got to not only be there for the community, but also provide the confidence to the community that the service you provide for them, is customer service, and as well as clinically strong and quality. So that is something that, we've worked really hard to make sure that we have the confidence of the community, that we're here for them, but also we're going to provide excellent care for them.
Laura's absolutely right. That reliability in healthcare and just being able to take care of them and know when you're biting off more than you can chew, and sending them to Navicent proper if that is what is needed.
Yeah. Do you have emergency rooms?
We
We do.
do. I have a very busy emergency room at Peach. We saw almost 23,000 visits last year, and for a small hospital, that is a lot.
Wow.
So we've had to make sure that we've been able to partner well with our colleagues at Navicent, as well as, we're close to Houston Healthcare, and if needed, we'll send patients there as appropriate. So having that connection of when you have a critical patient report to you or seek care at your facility, knowing what you can manage, and then having a process that you can get them to a higher level of care if needed.
And Alex, think about that from a patient perspective, right? They don't have to worry about making those decisions as to whether or not they're having a heart attack or is it just indigestion. So when time is of the essence in cases like that, they can come to us, they can come to the emergency room at Peach, or come to the emergency room at Monroe County Hospital, be seen relatively quickly, get the appropriate diagnostic testing, and then if they were just having indigestion, we can send them on their way back home. But if they are having some sort of cardiac episode, then we can quickly get them over to the heart tower at Navicent, and then it's a physician to physician conversation instead of them waiting in the emergency room to get care.
Right.
And
That's
that's how healthcare works, right?
yeah, yeah. That's so very, very outstanding, and it's important. I know there's a comforting effect in both Peach and Monroe with their knowing that you've got these facilities that can take care of them health wise. Okay, let's talk a little bit about technology. You all seem so excited about that. As a matter of fact, I have experienced it, and it's kind of strange, both L and L. It's kind of strange how the virtual visits have increased and are effective. As a matter of fact, I'm gonna just be honest with you. My producer had to hit me over the head for me to do the virtual interviews. I just didn't think that they would be. I just didn't think I would be comfortable or that they would be effective. But after having done it for about 2 months now, I love it. I love it, and it's much more convenient and it works. And I've also had the opportunity to do some virtual visits with my physicians. So, but I understand that there is some dynamic and interesting technology as it relates to virtual visitation with a medical professional. So each of you talk about, your program virtually at your facility and how it has helped and increase and enable you to see more patients.
So it's actually the same program, and we also have it at one of our sister facilities, Navicent Health Baldwin. So all three of our facilities have gotten what Atrium Health's virtual critical care card, which Laura's apparently going to demonstrate for you since she has it there in the background. But that virtual critical care card has just been enormous. And when you talk about just a touch of the button, high quality access to Atrium Health's specialty physicians, critical care nurses, and their team up there, for a rural hospital like Monroe County Hospital, it is literally what I had a conversation with one of our physicians. It is a dream come true, this telemedicine platform in the middle of a nightmare, which is the COVID-19 pandemic. But to literally, and I actually did it myself. I walked over, I was like, hey, I brought it down from the med surg floor to the emergency room so they could use it. And while the clinicians were taking care of the patient, I said, well, let me try to help them and turn this thing on. And I just touched the button on it, and suddenly someone appears and says, how can I help you? Give me the patient information and we'll get started. And it was just amazing. It's amazing for an organization like ours, with so few physicians, so few nurses, and the acuity of care of the patients that we normally take care of. And then all of a sudden you get in the door someone with a much higher acuity and you can't get them out because everyone's at capacity. To be able to have that assistance in the drop of a dime it has just been instrumental for our organization.
I call it a game changer.
So what you're telling me is that, if you've got, if you're busy at the hospital and however many doctors you have, on staff in service at the time are busy, then you can touch a button and get access to another physician who can help to advise and diagnose, that patient on the spot.
That's right, and in their specialty. So our emergency room physicians, and Laura can probably speak a lot more in depth to this, but our emergency room physicians, that's what they are, right? They're emergency room docs. They're not neurologists, they're not cardiologists, they're not hematologists, and we have access through that platform in order to reach providers such as those.
Now that's amazing. So if in fact you get a person with a kidney problem, you can hit that button and get in touch with a nephrologist.
Well, no, this button is just critical care doctors. This is just critical care.
Okay. So what you mean by critical care? Explain that. After we take a break. This is a call to action.
A call to action.
And I'm your host, Alex Habersham, interviewing Miss Laura Gentry of Peach County Hospital, the CEO, and Miss Lorraine Smith, the CEO of Monroe County Hospital. And we're having this interesting conversation about rural care and technology. And as I said, this is a call to action. I'm your host, Alex Habersham, having this very, very crucial interview on rural health care and technology that's helping to advance the possibilities of treatment for individuals who live in rural areas, because they too deserve access to health care and treatment. And when we left, we were talking about critical care, not only critical care, but we were talking about this technology that can help to address critical care and help to treat and diagnose individuals. So Ms. Laura Gentry, the CEO of Peach County Hospital, is going to just, not only is she going to explain how it works and what it means, but she's going to give us a live demonstration. Take it away, Laura.
All right, thank you. So basically for us, as we started planning for this pandemic and we knew that ICU beds were going to be very hard to come by, we wanted to make sure that our citizens, when they presented to our hospital, received the quality of care that they need, and that we could be guided with patients that are critically ill. So for us, what we normally do, if a patient comes in and they get very, very sick, we stabilize them and we send them to another hospital, to their ICU. We knew that may not be an option during COVID-19, this pandemic, so we wanted to be prepared. And we were fortunate enough to connect with Atrium out of Charlotte, North Carolina's critical care team. So it's called virtual critical care. So if I had a patient that came in and say they stopped breathing or they're having difficulty breathing, and we had to put the breathing tube in them, put them on the ventilator, the breathing machine, and start giving them a lot of different medicines that we're not used to giving. All I have to do now, because of virtual critical care in Charlotte, Atrium's critical care team, I push this little button on this stand here. It's a mobile stand. I can take it from room to room. I push this little button, and when I push the button, Chrissy Udy showed up on the screen. She is located just outside of Charlotte. She is a critical care nurse, and I would tell her, you know, what I have going on. I have a critical patient. This is what I've got. And then Chrissy would give me direction. You want to say anything, Chrissy? She would give me direction and then connect us, our physician, with one of the critical care doctors there in Charlotte. So that's how that works.
It's basically, yeah, we're just available 24 hours a day, just to help the bedside get the patient the best care that they can offer at the site, and keep them close to home, and just kind of offering that level of care that they weren't able to do before.
Well, I would suspect that this mechanism and this technology is helping to save lives, because I'm sure all of us realize that time is of the essence when a person is critically ill, and I know that you are just totally excited about having access to this phenomenal technology. So now talk a little bit more about it. So what do? You give the person on the other end the crucial information, and is it also video? Can they see you and can they see the patient?
Yeah, so I would bring this in the room with the patient, and Chrissy would be looking at the patient, doing her own examination. Here's the camera right here. She could zoom in on the patient. She might ask me, well, Laura, what's the patient's lab work? And I would just turn and let her see the chart. She could look at all the information on the patient as far as what their lab work looks like, what their vital signs look like. You know, and so she's doing a physical exam. And like I said, she will flip us over to the doctor. So she'll get us started and then connect us with the doctor. And so then our doctor and their doctor just starts talking back and forth about the patient. You know, an example might be if they're on the breathing machine, they may tell us, you need to set the amount of oxygen that this patient gets. You need to go up with it. You need to go down with it. You need to, you know, just constantly telling us what we need to do to stabilize that patient and keep them for an extended period of time until we can find an ICU bed. So basically we become an ICU. It's a virtual ICU is what we're doing. It's great. It is really great. And they've all been, I mean, it didn't take me any time to get her. Once I push the button, she's there. And then she connects me to the doctor. There's a little, maybe 4-minute delay sometimes with the doctor, but 4 minutes is nothing.
Wow.
So it's a
Right,
way.
we try to be available within about 5 minutes, hopefully, and it depends on, if we've got calls, facility and nothing going on as well. But obviously, like you said, time's of the essence for us to get in there. So we want to get in there and see the patient and see what's going on, get them care as quickly as possible.
That is so outstanding. It's giving me chills, Lorraine, just to see and
Back to
hear it.
work. So when we're done, I would just say thank you, and we log out.
Well, let me say thank you too. Thank you.
Thank you, Christy.
Thank you. I appreciate
Have
it.
a good afternoon.
Thank you.
Lorraine, did you want to add anything to that as it relates to the experiences that you've had in your hospital with what is the unit called? What is that called?
It's called a virtual ICU card, virtual critical care card. Exactly
Okay.
like Laura termed it. Mm-hmm.
Okay. Virtual critical care card.
We call it VCC.
I got two other questions. Have you all had the experience of having to treat COVID patients and use the virtual critical care card?
Multiple times.
Wow. And it works.
It works.
It
Yeah.
does. It's a big helping hand. Absolutely.
And we're allowed to use this cart for all patients, not just COVID patients. So for any critical patient that we get, we can use the cart.
So I guess the same would apply. Let me ask you this. So when you said critical care, does that apply to the emergency rooms, like for accidents and things of that nature? If something very serious were to come into the hospital, that a patient in bad shape, and could you just plug in and see a trauma doctor? I'm not looking. I don't know as much as I'm trying to act like I know, but a trauma physician. So does it apply when it's critical across the board, irrespective of what the particular problem may be?
Yes.
At any time, any of our doctors feel they need a consult, a consult with a critical care doctor, we can ring that bell.
Yeah, that is so outstanding. Can either of you, and it's okay if you can't think of any particular scenario, of course, without calling names, of a particular situation wherein one came into the hospital and you were able to plug into it, and that, served as a technological benefit and a practical benefit and a physical benefit and a health benefit to treating the patient?
And so like Laura said, I think there's lots of instances and right now, like even in this moment in time, Monroe County Hospital has an ICU patient that we normally would not keep or not be capable of keeping. But thanks to that virtual critical care cart, we're able to get assistance to keep that patient at our facility and still provide that high level quality of care.
Okay, do you have any space left for ICU? I mean, I know that most of the hospitals, as a matter of fact, I saw a comment from Navicent and Houston Healthcare and Coliseum the other day, putting out a joint statement encouraging people to be aware of, to be very conscientious about, COVID-19 and practice safety and things of that nature. So I know how important it is and how crucial it is, but do you have any space left? Or do you have to send them somewhere else?
Well, and that's the issue, right, Alex, is that the places where we would send them, they are at capacity. So we're having to keep them. When they walk into our facility, they are our responsibility.
Wow.
So until we can hand them off to another facility that's appropriate for their care, we are ultimately responsible for them. And that's the reason this virtual critical care cart that has been given to us at our rural hospitals has just been like Laura said, a game changer for our facility, because we're able to keep those higher acuity patients and still provide quality of care for them, because we have that assistance from the clinical team at Atrium Health.
And we've had few patients that we were able to bring the cart in and they gave us some recommendations and we saw the patient improve. So they never got to that point of requiring a breathing machine, or, so we were able to turn the patient around. We, bring the cart in the room and say, this is what we've got. This patient's doing this and this, and they can give those recommendations, that allows us to intervene before the patient declines significantly. So it's, we're bringing it in as early as we can when we see a patient is declining or is critical or has some signs, warning signals that, hey, they're not turning around like we want them to. So when you talk about examples, when you said that a while ago, I could think of several just right away early on when we first got the cart. We started ringing that doorbell early, because I will tell you, these COVID patients are very, very sick. A lot of them. So we want to be prepared.
Well, you can't begin to imagine how happy, it makes me, because I'm a firm believer that healthcare is a right and that everybody deserves it. And I think that everybody deserves quality healthcare.
I do too.
And I realize that there have been some obstacles, in rural communities. So to see this happen, and for you all to be the CEOs of these two rural hospitals and doing such a phenomenal job with the assistance of what's that machine called?
BCC.
Virtual care cart, right?
Right.
Yeah. With the assistance of the virtual care cart, then it's important to the community, and of course, it's very important to the hospital. Lorraine, you got 30 seconds for a parting statement.
So I just think, again, I think we're all stronger together. This is a perfect example of how a small hospital like Monroe County Hospital in Forsyth, Georgia, partners with Navicent Health, who partners with Atrium Health, and we're all better off for it. So, bravo to those organizations that are help taking care of each other and working together to do what's best for patients, like you said, because everybody deserves that quality of care.
Laura?
Well, I think Lorraine said it wonderfully, and I will tell you, I love working in a community that it's your friends and your neighbors, and we're caring for each other, and I just love it, and I'm proud to be a part of Navicent Health and Atrium Health, and having the opportunity to deliver this quality of care to our community.
And I'm proud of both of you. Keep up the good job and continue to provide the best possible care to our friends, colleagues, family, and neighbors. And neighbors in rural communities. This is a call to action.
Call to action.
I'm your host, Alex Habersham, and thank you all for doing such a good job. Thank you for the opportunity to provide this information to the community. I hope both of you continue with Godspeed and have a great day.